Hi, my name is Kunal Amin, and I'm a fourth-year medical student at Duke. I'll be presenting on behalf of my team for our project titled Natural Language Processing for Early Identification of Pulmonary Embolism. The purpose of this project is to develop and validate an NLP-based clinical decision support tool for early identification and risk stratification of PE in the emergency department. A PE is a clot that can form in the deep veins of our lower extremities or pelvis, travel up through the right side of our heart, and can become lodged in our pulmonary arteries, thus obstructing blood flow to our lungs. Early identification and risk stratification of this condition are important because of the heterogeneous clinical presentation. Patients can come in with a wide spectrum of symptoms, ranging from being totally asymptomatic to being at high risk for hemodynamic collapse. Additionally, for low-risk PEs, current guidelines recommend outpatient management, although many who present to the ED are unnecessarily hospitalized. For higher-risk PEs, incomplete risk stratification can result in delayed care and lead to poor outcomes. This is a workflow of our proposed solution. When a patient comes to the ED with a suspected PE, the ED provider would typically order a CT-PE protocol imaging study. A radiologist would then read that study and enter their findings in the form of a free text radiology report. We're proposing an NLP model that can identify the presence of PE based on that free text, and that information would then be used to drive downstream risk stratification and clinical decision support. In this presentation, I'll be focusing on the development and validation of that NLP model. This goes through our approach. We first abstracted all CT-PE protocol imaging studies from our institution's ED over an 18-month period. To create a labeled dataset, we adjudicated each of those reports as being present or absent for PE. Next, we applied standard text preprocessing to each report, including extracting the impression section, which usually contains the most important information. Each report was then converted to a high-dimensional bag-of-words vector in which each dimension was the term frequency, inverse document frequency score of each of the 1, 2, and 3 grams in the corpus. We then use that information to construct an L1 penalized logistic regression model. This goes through our results, going through the top predictive features of the model. You'll see that many of these terms are clinically relevant and associated with the presence of PE, including terms like right heart strain, the location of the PE, be it bilateral, segmental, or subsegmental, and other terms like non-inclusive or RV to LV ratio. The performance of our model on our internal validation and temporal validation cohorts was strong. Our area under the curve was 0.99 for both of the cohorts, with sensitivities in the high 80s and specificities in the high 90s. In conclusion, NLP can be used to accurately identify presence of PE based on radiology reports. The model we developed identified clinically relevant terms associated with PE. Thank you so much for your time.